Okay, we've gotten all the way to chapter 19, and we're going to start talking about our gram-positive bacilli, especially those that are of medical importance. We can subdivide these into three general groups based on whether or not they have endospores and if they're acid-fast. The three general groups are your endospore formers, the non-endospore formers, and those that have irregular shapes and staining properties. Now, an endospore is a survival unit, and it develops in a vegetative cell when it doesn't have enough nutrients. And most of the bacteria that make endospores are gram-positive, they are motile, and they're rod-shaped forms coming from the genera Bacillus and Clostridium. Remember, endospores are resistant to heat and drying and radiation and chemicals, anything that might kill a vegetative cell. They resist that because they are in survival mode. And you can see here the vegetative cells and the spores that they form. Now, this is a table of gram-positive bacilli, and you see you've got Bacillus anthracus there that can cause cutaneous or pulmonary anthrax. Bacillus cereus, which we work with in here, food poisoning. You've got the Clostridium perfringens that causes gangrene in food poisoning. Tetanus is caused by a strain of the Clostridium. C. diff is a bad bacteria that can affect your gastrointestinal tract. You've also got botulism in this and listeria. Now, the general characteristics of the genus Bacillus: they're gram-positive, they form endospores, and they're motile. They're rods. Most of them are saprobic. They are aerobic and catalase positive. They are a source of antibiotics, and they mainly are found in the soil. And there's two species that we're going to look at because they are of medical importance: Bacillus anthracus and Bacillus cereus. Now, the Bacillus anthracus or Thracus is a large block-shaped angular rod that is non-motile. And the virulence factors here, they have a polypeptide capsule and exotoxins that can cause edema and cell death. Most of the cases that are reported are from livestock, from Africa and Asia and the Middle East. But there's three types of anthrax. There's cutaneous anthrax, where the spores enter through the skin, and it's the least dangerous. There's pulmonary anthrax, where the spores are inhaled, and then there's gastrointestinal, where they're ingested, and this one is very rare, but it is lethal. How do we control it? We treat it with clindamycin, doxycycline, or ciprofloxacin. Sometimes you get another drug, and pronunciation here is difficult, so bear with me. Roxibacumab. And it's trying to use some antibodies that will bind to the toxins to keep it from entering the cells. And there are vaccines for people that are at high risk, occupations, or military personnel. Now, Bacillus cereus is commonly found in the air and in dust. And disinfection and antisepsis don't get rid of it. It grows in food, and the spores can survive the heat of cooking and reheating. When they are ingested, this bacteria is ingested, there's nausea, vomiting, abdominal cramps, and diarrhea. Usually lasts for about 24 hours, so most of us think it's a stomach bug. And there's not really any treatment other than treating the symptoms. Moving to the genus Clostridium, the characteristics here: gram-positive spore-forming rods. This one's anaerobic and catalase negative, and there are about 120 species that we know of. They can synthesize organic acids, alcohols, and exotoxins, and they cause wound infections and tissue infections, and they can also be in your food and be ingested. Clostridium perfringens is the most frequent Clostridium that's going to be found in wound infections. The spores are in soil, on your human skin, your intestine, and in the vagina. People that are predisposed to having problems with this have had surgery recently, or compound fractures, diabetic ulcers, puncture wounds, gunshot wounds, and the virulence factors here: they have an alpha toxin that causes the red blood cell rupture, edema, and tissue destruction. The collagenase, the hyaluronidase, and the DNase. All of those. With gas gangrene, there are two forms. Myonecrosis is the name. And in the anaerobic cellulitis, it spreads within damaged necrotic muscle tissue, and it produces toxins and gas, but the infection remains just in that area. It's localized. But in true myonecrosis, it's more destructive, and it will move out of that area. When the muscle carbohydrates they ferment, they form gas, and that further destroys the tissue. And I think you can see here it's not pretty. To treat it, of course, you need to cleanse your dirty wounds, your fractures, your incisions. Debridement of the diseased tissue, cephalosporin, penicillin, hyperbaric oxygen therapy is also available to use, which is what's happening here. So which of the following is the mode of transmission for Bacillus cereus? Ingestion.